All right, so I think we have everybody on here. I'm going to go ahead and start. My name is Chris Cornell. I'm the AMSSM MSIG 2020 president. And today we have the Family Medicine, Sports Medicine, A Day in the Life of series. We've had a couple of these series already with orthopedics and emergency medicine, and they've gone very well. We have a panel of guests here tonight, and we'll just kind of discuss kind of their day-to-day operations, kind of their perspective from family medicine into sports medicine, maybe kind of shed some light on their decision-making process as a student, trying to like decide which residency they were going into sports medicine, and then maybe some of their perspectives as a possible resident looking into sports medicine fellowships and kind of how they're going to be able to make themselves a better applicant through these COVID times. So I'll start with introducing Dr. Jacklyn Kiefer. She was born and raised in Denver, Colorado, and went to medical school at Howard University College. A practicing physician with Community Health Network. I'm like, this doesn't sound right. This does not sound like her. Practicing physician with Community Health Network Sports Medicine in Indianapolis, and is the fellowship director there. She is also the head team physician for the University of Indianapolis. And then we have Dr. Daniels. That's who I was trying to describe before. He was born and raised in Denver, Colorado, and went to medical school at Howard University College of Medicine. He completed his residency in family medicine and primary care sports medicine at Penn State Hershey, and is currently an assistant team physician for Harrisburg Senators. Dr. Swartzon, he joined us just a minute ago. He's an associate professor for Florida International University. He's an affiliate professor for Nova Southeastern University and PD for Baptist, and the program director for Baptist Health's Primary Care Sports Medicine Fellowship. Dr. Swartzon also has significant experience working with professional athletes as a team physician with the Miami Dolphins, and is one of the forefront and uses a lot of biologics in his practice as well. Dr. David Wang completed family medicine residency at UCSD and his sports medicine fellowship at UCLA before coming to the East Coast to assist at both Hospital for Special Surgery and Weill Cornell Medical College. Works for both local high schools and colleges within New Jersey, and was most recently named the head team physician for the New York Guardians of the XFL. And last but certainly not least, Dr. Nathaniel Nye, Nate Nye, assistant professor, program director of the Military Sports Medicine Fellowship, and founder of Viper, the versatile injury prevention and embedded reconditioning sports medicine clinic, which extends frontline care to the Air Force basic and technical training. With this program, he also executed a 3-year research grant with data showing a $3.3 million per year savings per single squadron. Something I definitely want to hear more about during our discussions. I think that's really cool. So why don't we go ahead and start with you again, Dr. Kiefer, and kind of just give us a little bit more details on your introduction.
Yeah, so hi everybody. My name is Jackie Kiefer, and I am originally from a small town west of Indianapolis called Brazil, Indiana. Only creates a little bit of confusion. I don't speak Portuguese. And I grew up there. I went to undergrad at Notre Dame, go Irish. And I went to the University of New England College of Osteopathic Medicine for my medical school. After finishing medical school, I ended up coming back to South Bend, where I went to St. Joe Regional Medical Center, family medicine residency. And then I went on to fellowship at Toledo Hospital Sports Care Fellowship in Toledo, Ohio. As I kind of went down that road of kind of talking about kind of how I came to be where I am, I originally thought I wanted to do orthopedic surgery. I was completely convinced I wanted to be a surgeon. My summer job when I was in college was with an orthopedic surgeon who eventually was my hooder. He is still a mentor of mine. He was a DO. He exposed me to osteopathic medicine, and then also exposed me to a lot of orthopedics and sports medicine. As I kind of spent more time around surgery and around the OR, I kind of realized that, you know, I love taking care of athletes. I love the physical exam of musculoskeletal medicine. I love injections. I love casting and splinting. I kind of hate the OR. And that was sort of how I started thinking about, well, what's another way that I can do sports medicine and really embrace the things that I love and kind of not have the things that I didn't love as much. And so my dad was a primary care physician. So I had primary care in my life from a young age. And actually, I think that's initially why I didn't want to do it, was because I was like, oh no, I don't want to do that. It's a little bit of like college rebellion or something. And so I then saw the light. I was exposed to, I kind of was looking up some things and I came across primary care sports medicine. And I was like, oh my gosh, this is the thing that I love. Lets me do something, lets me watch sports pretty much for a living, which I love. I mean, any job that you can do things you enjoy is always going to be great. I decided to go the family medicine route because I felt that I really liked the idea of, and kind of osteopathic family medicine too, because I really liked the idea of kind of embracing the whole person, of kind of really seeing all the different aspects of a person. And I think that's even more so important in athletes. I mean, we treat their psychological conditions. There's such a focus on mental health. We help them when they're ill, when they're having chest pain, when they're having COVID. You know, all of those things are places where we're involved in our athletes' lives. And I really felt that family medicine was going to prepare me incredibly well to meet my goals. When I chose my residency, I intentionally chose a residency that had a sports medicine fellowship because I knew that I wanted to get exposed more to that. And so that was something that I really enjoyed over my 3 years of residency. It kind of gave me that feeling of when I was on OB call, like, man, you know what? I'm going to go to a game this weekend. This is going to be great. And so I love family medicine. I actually, I still practice in a family medicine residency and do primary care, as well as the primary care I provide for my college that I take care of. And then I do orthopedic. I work out of the orthopedics department about 4 half days a week as well. So when I kind of came around to the question about my typical day, it's really interesting because it kind of depends on what day. I spend time, today I worked all day in sports medicine. So I had a full day of working in the orthopedics department. A lot of other days I spend precepting residents, I spend teaching medical students, I spend doing didactics and kind of more academic kind of didactic pursuits for residents. Obviously, I'm starting a fellowship, so that is where a lot of my academic energies are going here right now as well. I've been doing a lot of interviewing. I also, though, do training rooms for University of Indianapolis and for Warren Central High School, which is one of our schools here in the city. And so those have all been things that keep me happy. I love having a varied schedule. If I did the same thing every day, I don't know that I would enjoy it nearly as much as I do. I know that my schedule isn't probably for everybody, but I really enjoy the variety. And then I do, as far as my interests in sports medicine, I very much enjoy sports ultrasound. I do diagnostics and injections. I do some PRP as well. I love taking care of female athletes. That's always a population I enjoy. I also am very passionate about education, especially musculoskeletal education in family medicine residencies and obviously fellowship education. Let's see, let me think if I got through most of the, oh yes, COVID's impact on my practice. Besides the fact that I feel like I have probably at least a minor in COVID management at the collegiate level right now, I feel like that probably it's had the biggest impact on my universities. My own practice, when elective surgeries got shut down, the orthopedics practices, we pretty much closed to everything except for fracture care and emergencies. For a couple of months, we were actually under so for our residency programs, we were actually under the ACGME sort of state of emergency. So we had a couple of months where we were reallocated and doing some different things. And so that was obviously some adjustments in there. We went back to kind of our quote unquote normal practice in probably June, July, and we're still currently here in Indianapolis doing okay-ish. And so we are still up and running as far as kind of normal practice stuff. Our sports are still going, things like that right now. Obviously, I feel like that's a day-to-day, week-to-week kind of thing. But fortunately, currently at least, we're holding somewhat steady, at least in Marion County. So in the city, we actually have stayed under a little bit tighter restrictions than the rest of the state. And so I feel like it's interesting, actually, Indianapolis has possibly held on a little bit better than some other parts of the state. So that's been kind of interesting to watch. So yeah, that's me.
That's good. Thank you so much. Dr. Daniels, would you like to continue the discussion? You may need to unmute.
Thank you. Thank you so much for having me on this panel. I appreciate it. And thank you for the opportunity to share my story. So I'll actually start from the beginning. What actually made me go into medicine was that at the age of 8, I witnessed my grandmother have a heart attack. And my grandmother was one of the individuals who was taking care of me. At the time, my parents were separated. So she was the one who used to take me to school and pick me up from school. And when she had that heart attack, it was really, really tough on me because she was the one who was really taking care of me at that time. So she was in and out the hospital for the next few months, and I really didn't like that. And I felt that maybe if I became a physician, that I would be able to help other people's grandmothers prevent from having a heart attack and going into the hospital. So I pretty much stayed with that. And I went to school at Xavier University of Louisiana. Then after that, I did a post-bac program for 1 year in Indianapolis, and I got accepted into Howard University College of Medicine. And during my time at Howard, I really liked several different specialties. And after graduating, I ended up doing a year of general surgery and was in the OR and really realized that this wasn't for me. I decided to go back to school. I got my MPH because I wanted to really help out with my community and with public health. And that's really when family medicine really came forward for me. I still wanted to be able to help people like my grandmother, and it really felt that family medicine, family and community medicine was the perfect match for me because I wanted to help with preventative measures and I wanted to help my community as a whole. Growing up, I always participated in sports, in particular basketball, and I really loved being at basketball games and all different types of sporting activities. I really feel that athletics and sports is a great outlet, and it's a great way to stay physically active and healthy. And being on the sideline and being an athlete myself, I really thought that sports medicine was an incredible field to actually help an individual get back to the activity that they love, to get to an activity that will keep them healthy. I thought that was a perfect fit. When I learned more about it, that it's not just taking care of athletes, that you take care of elderly patients, that you take care of people who want to get into exercise, either further push me more. So I matched at Penn State for family medicine, and similarly, when going for residency programs, I wanted to look for a program that had a fellowship so I could get that exposure as a resident. And I stayed on. I was able to match as a fellow at my same institution. Since then, I've actually been able to stay on as faculty as well. I do both family medicine and sports medicine. So 2 days out of the week is my sports medicine, and the remainder of the working days is my family medicine clinic. So during my family medicine clinic, of course, I see patients from pretty much from womb to tomb, as we used to say. I don't practice obstetrics anymore, but I do see young patients. So the youngest patient on my schedule today was 2 days old, just a newborn out the hospital. Last actually, yes, last week I saw my oldest patient. She's 94 and she loves walking, and we have great conversations about how she stayed active and how she has stayed so young. During my sports medicine clinics, I have see all different types of people. I see young athletes, I see older people, I see people who are needing injections. I perform ultrasound guided injections in different parts of the body, in which I use the ultrasound to see nerves, tendons, arteries, veins. So I think it's a great field. So in terms of COVID, when COVID first occurred, pretty much things started to shut down. We immediately moved to telehealth. So that way we still had access to our patients, and we're still able to see patients. My sports medicine clinic slowed down quite a bit, but when things started to open up in May and June, I had an influx of people who really needed injections because they had been experiencing pain for so long, just waiting. When we opened up again, that's a lot of the things that filled up. Unfortunately, for the minor baseball league, their season was canceled. So I didn't have any professional sports experience this year. But I anticipate how things will change in the upcoming year, that next year, hopefully we'll be up and running. So that's a little bit of tidbit into my life as a sports medicine physician. I think being a family medicine and a sports medicine physician is a great field. I work in an academic center. So I also teach students and residents. I didn't learn all this information on my own. I feel as it's important as a physician to give back, so to teach the next generation. So that's why I'm doing.
Awesome. Appreciate that story, Dr. Daniels. Thank you very much.
Thank you.
Dr. Swartzon, seems like you're ready.
Yes, happy to go and almost repeat the previous two stories. My story is very similar to Dr. Kiefer's. I went to college at Cornell and ended up going to medical school internationally. I went in Israel, Tel Aviv University. And in my fourth year, I did a elective at UPenn in orthopedic surgery. And that's really what I wanted to do. And kind of slowly throughout the elective, I realized that I didn't like the operating room either. But I really liked seeing the athletes. I didn't like working the 40-hour shifts in basically 2 days. And at the time, there was a AMSSM member there, David Wang, who pulled me aside, and he's like, "Hey, why do you want to do that? Why don't you do what I do?" And I was like, "What do you do?" And he's like, "Well, I'm a family doctor, but I work in the orthopedic department treating the athletes. I cover the games. You know, I do everything they do, except I don't have to be in the OR and I don't take call." I said, "Yeah, that's what I want. Let me do that." So because it was so late in medical school and I didn't have any physicians in my family, and I'm from Miami, and Miami is very much a specialist town, so there really wasn't very many family physicians. My family medicine rotation in medical school was almost my last rotation. So I didn't get exposed to it or know anything about it. So between meeting Dr. Webner while I was on my elective and then doing my rotation in family medicine, I thought this is such a great fit for me. You know, sometimes it's just luck because Dr. Webner was great and my preceptor for family medicine was awesome. And so made the decision very easy for me to go to family medicine. It seemed like I get to do a little bit of everything everywhere. And that's kind of how the residency is. You do a little bit of ICU and, you know, emergency medicine, family medicine, you're in nursing homes, you travel to people's houses. I mean, it really is great. So even though I knew that I was on a sports medicine track from the beginning, I really enjoyed my residency a lot, and use a lot of the skills that it taught me to take care of all the athletes that I take care of now. I did my residency at University of Kansas, and then I did my fellowship at University of New Mexico. And then I came back down to Miami, where I work for a large healthcare system as an employed physician. But I get a lot of opportunities to stay involved with academics. So I have a medical student that rotates with me, usually a third or fourth year. I have a resident from the Residence Family Medicine Residency Program that comes once or twice a week. And then I have my fellow, which is great. And in clinic, I see mostly orthopedic cases. So I'll see about 25 patients a day or so, various things of all ages, head to toe, some acute, some chronic. You know, most of it is chronic and most of it is older adults. Today, my youngest patient was 14-year-old girl with a concussion from a soccer ball. And I think my oldest today was in the upper 80s. But, you know, Florida has a lot of elderly population that's extremely active. And so they really try and push it to the limits. And it's really funny because I'll treat, you know, my 91-year-old tennis player the same as I would a Miami Dolphins player, and try and push the limits of what we can do, as long as, you know, everything is very transparent about the risks and benefits of everything. So it's a lot of fun taking care of that wide of a group. As far as my COVID experience recently, I take care of high school athletes. And so I've been on this Florida High School Association, and South Florida's had to leave the rest of the state as far as high school sports association, because they couldn't agree on COVID terms, which is, you know, really a shame, because now the state champion isn't really a state champion. And then in the college setting, I take care of two colleges. One is a Division II school that canceled all their fall sports. And then the other is an NAIA school that has 800 athletes and kept going. They have no funds really to speak of. And so they're not doing any testing. It's all based off of symptoms. And so far, we've had 140 cases from that school out of about 800 athletes. And thankfully, no hospitalizations, no issues from that standpoint. And then I take care of a professional team, and I'll get tested every day. I get tested with every player every day. And we know if someone tests positive, I know the genome of that exact strain that they have. And so it's very interesting to see things from, we don't test at all, we just treat symptoms, to knowing I have videotapes of who's wearing a camera and who's not. And I have these contact tracers that tell me to the second how long people were within 6 feet of each other. So it's very interesting. I'm learning a lot through this. But aside from that, I think a lot of what I would say would be a repeat of what the previous doctor said. So for time's sake, I'll pass my time on to the next physician.
Sure, thank you very much. So another story where just the OR room just was not the fit.
No, just not a fun environment. Everyone's angry there.
Stressful.
People throw things at each other. It's not nice.
Thank you, Dr. Swartzon. Dr. Wang, would you like to kind of continue?
Yeah, well, piggybacking off that, and I don't need to tell my story because I think we're pretty much the same as the other three. But thank you for the opportunity to tell my story, and I love these opportunities. This is one of the reasons I'm involved with AMSSM and with the Medical Student Interest Group, is because I think we can get these stories out there to people earlier in their career. A lot of people will realize how great of a field we have, and that's kind of how I got into it. So I knew from a young age I wanted to do sports medicine. I say even back when I was like 10 years old. With Little League elbow, seeing an orthopedic surgeon, I just remember sitting in his office, looking at the walls, all these athlete pictures, and thinking, how cool of a job, that this doctor has. And so I basically, my whole high school, college, I was on the path of sports medicine. At the time, I saw a lot of orthopedic surgeons for injuries. Unfortunately, I never actually had to have surgery. And so in my mind, sports medicine and orthopedic surgery was kind of, the diagnostic, clinic. but I thought you had to be an orthopedic surgeon to do sports medicine. So I kind of went through, college and beginning of medical school, shadowing orthopedic surgeons and doing my, my selective time when we weren't, in the classroom. It was with orthopedic surgeons. And in my third year, I got to my orthopedic surgery rotation. I'd been waiting forever for it. And similarly, I got in there and it was kind of, not what I really expected. And I think some of the best advice I got was from one of the orthopedic surgeons who told me, if you don't absolutely love the operating room, get as far away from it as possible. And so, I kind of took that to heart. And I even realized during my rotation, that the most fun I had was, when I had a half day in the clinic. And I realized, really that was more the setting I enjoyed. And I was fortunate that my family medicine rotation was after my surgery rotation. And I remember talking to a fourth year student at the time about my experience. And she mentioned, she had a classmate who had switched to primary care sports. And she asked, have you heard about this field? And I didn't know anything about it. And so I was fortunate enough to switch my family medicine rotation. I had picked a rotation at the time. I was at school in Boston, and there was one rotation. I had one of the highest rank lists, and there was one rotation, and you could go to Vermont and do a few weeks in Vermont. And I just picked that because it sounded like fun. But fortunately, when I learned about sports medicine, they were able to switch my rotation last minute to a family medicine doctor who had a fellowship training in sports medicine and really incorporated it into his practice. And that's when I really got exposed to it, and really the light bulb went off, and I knew this is kind of what I'd always pictured in my mind for sports medicine, what I always thought I would be doing. And so from there, I knew primary care sports was the path for me. And really, when I was looking at residencies, family medicine really was the best choice for me, for a few reasons. One, I liked the fact that there was actually dedicated curriculum to sports medicine in it. I was considering pediatrics. I liked working with younger adolescent athletes. And so I thought maybe pediatrics would be a good path, but when I kind of looked at everything, the fact that family medicine offers you months of training just in sports medicine was very appealing to me. And then I think, like Dr. Kiefer mentioned, when you think about taking care of athletes, obviously orthopedics is a big part of it, but we're taking care of the whole athlete, and family medicine, every part of it, whether it is obstetrics with your pregnant athletes, to again psychiatry, mental health, it all plays a role in our athletes. And so I really felt family medicine would really help prepare me for my future in sports medicine. So I ended up matching at UC San Diego, and I think like a few of my colleagues mentioned, I really try to pick a residency that had a fellowship affiliated with it, because I think that just offered a lot more opportunities. You're getting to work with their fellows, doing a little bit more extra sports medicine on the side, which was very beneficial. And then I ended up doing my fellowship at UCLA. And then after I finished that, I kind of moved back east, and I started at Hospital for Special Surgery, where we're a musculoskeletal hospital, so I just do basically non-operative orthopedics and musculoskeletal medicine all day. And I think that was one of the other things that appealed to me about family medicine is there's so many different paths you can take out of it. Even if you want to do sports medicine, you can do full-time sports medicine, you can do half sports medicine, half primary care. You can do all primary care and just have a little bit more expertise in sports medicine. And so I ended up, I really just love sports medicine and the orthopedic aspect of it. So, I think HSS was a great fit for me. So I see, again, non-operative orthopedics pretty much all day. And again, the variety even with the family medicine background, again, getting to see, young pediatric athletes as to, our elderly, active, 80, 90-year-olds with arthritis who just want to be able to go for their walks. It still provides me enough variety where, you don't get bored, and it keeps things interesting. And so that's kind of how I ended up, where I am. And in terms of COVID, it's, pretty similar. So I was working for an XFL team here in New York at the time, which unfortunately our season had to be canceled, and unfortunately our league also had to file for bankruptcy. So that obviously put an end to the season from that perspective. And then even at our hospital, so obviously here in New York, we got hit pretty hard with the first wave. And so our hospital actually, basically, since we're a musculoskeletal orthopedic hospital, when elective surgeries were banned, basically we switched to a COVID hospital. We worked closely with Weill Cornell right next door, and they were kind of getting overflowed. And so we had the hospital bed. So we basically turned into a COVID hospital. A lot of our colleagues, again, having that family medicine background, switched, volunteered, and were basically taking care of those patients in the hospital. Personally, I was out in the satellite office. We kind of switched our satellite offices into almost orthopedic urgent cares or emergency rooms, trying to divert any orthopedic issue, not having to need patients go to emergency rooms where they were obviously busy taking care of COVID patients. So we try to basically turn all our satellite offices into basically emergency rooms for any orthopedic issues. And then, I think around June, July, we're starting to get back to a new normal. We're still, again, a little limited with how many patients we can see and social distancing, but I think we've developed a good protocol, and we're hopefully back to the new normal for now until we can get back to our previous normal.
That's an interesting perspective there from New York during that time as well. So thanks for doing that for everybody, I guess. Thank you very much, Dr. Wang. And now, Dr. Nye, would you care to kind of finish up, wrap up the introductions, and then we can get to some more questions?
Absolutely. Yeah, pleasure to be here with all you guys tonight, and really good listening to the stories of all of the other panelists. I also share a lot in common with all of the other stories that have been shared, but there are also some unique things. So I'll try to focus on those a little bit. So a little bit about my background. I went to BYU and graduated in 2006, went to Ohio State, go Buckeyes, for medical school. So fantastic training there. However, it was, primary care really wasn't a focus there. I loved every rotation that I did. I thought I wanted to be a psychiatrist. I thought I wanted to be a neurologist. I thought I wanted to be an orthopedic surgeon. I thought I wanted to do family medicine. I just loved everything. So I ended up doing family medicine, which I thought was, a great way. I wanted to own, like others have said, I didn't want to have like a part of the body that I didn't know anything about. I wanted to be able to be comfortable with an entire patient. And so that's why I chose family medicine. There were some excellent family medicine mentors at Ohio State that really helped point me in that direction. I'm also in the military. So since I, ever since I graduated from high school, I signed up for an ROTC scholarship. And so I did ROTC training. I did a minor in aerospace studies, and I got my commission to the Air Force out of BYU in 2006 as a second lieutenant. And then I went into the inactive reserve. Basically, I put my uniform in my closet for 4 years. And while I went to med school, so I was on an HPSP Health Professions Scholarship Program, scholarship while I was at med school, which provided full tuition and everything while I was out there studying. And then as soon as I graduated from medical school, I put my uniform back on, promoted to 03 captain, and started an active duty family medicine residency out at Nellis Air Force Base in Las Vegas, which was phenomenal. Absolutely top-notch training. I would do it again in a heartbeat. I learned about sports medicine when I was there. I think Michael, I wasn't really exposed to this early on. It was in residency that I figured out that primary care sports was a thing. And I had a fantastic mentor who I still keep in close touch with. And he really is the reason that I'm here doing this today. But I just found it was same thing everybody else said. It's a great way to, take care of the whole patient, but also to, help people get over their injuries and get back to what they love and being active and being healthy. So, I loved it. I went to an AMSSM meeting in 2012 for the first time, and I was just floored. It was like, I was riveted to my seat. It was just, I couldn't believe how cool it was and how much I was learning. And I was like, this is where I belong. So I really loved, it was just incredible. I just really felt like it was my home and my calling. So I really am grateful for AMSSM because it really has been a great way to collaborate and learn from other people and everything. So I've enjoyed being part of AMSSM. Oh, by the way, I think I need to say this, so I'm going to say it right now. I am in the military, but these opinions are my own. I am not speaking on behalf of the DoD or any of its components. So this is all Nate Nye, not any rank or anything else. So I just have to give that disclaimer. So anyway, I did a 3-year family medicine residency at Nellis, and then I went straight into fellowship. I came right here to DC, where the military has a large sports medicine fellowship program. And boy, that was just a phenomenal year. Trained under Anthony Butler, Fran O'Connor, and just a tremendous training. From here, well, I'm back. So I am now teaching at the same program where I was trained back in 2013 to 14. So I went to Lackland Air Force Base in San Antonio for 5 years. That was the first, so I was the first sports medicine doctor that the Air Force had ever put into that training environment down there. And so let's see, I'm going to give a few minutes to let me just tell you about that a little bit. So Air Force basic training is a huge operation. It's, 40,000 high school graduates come out from all parts of the country, and they all convene on San Antonio. We get a busload of about 800 trainees, recruits every single week. They get off the bus, they're wearing their civvies, they're scared to death, and they get, we turn them into airmen, and we indoctrinate them into the military. So, they are running, they are doing physical fitness training, they're marching, they're wearing boots, they're doing, shooting their guns, and they're going to classes, and they're learning all about the military. So for many of them, physical activity wasn't a big part of their life. A lot of the kids that were, playing football in high school, well, they're playing football in college or something. They're not, there are some very, physically prepared people, but there's a lot that aren't. And so the bottom line is you get a lot of novice athletes who are running and training, and they get hurt a lot. So there's a huge demand. I don't know how, they made it that long without any sports medicine expertise at all. But anyway, so needless to say, there was a lot of work to do, a lot of things that were being done backwards. And so I had a lot to do. But one of the big things that I took on down there was to basically establish a huge sports medicine program, much like you have at a university, but basically starting from scratch. And it's built to support a big military training operation. So what we did was we applied for a grant, and we got it. So it was like $1 million 3-year grant to hire 4 athletic trainers, and we put them into one of the squadrons. So that a squadron is like 1,000 recruits, if you just keep that in your mind. So we had, and there's 8 squadrons. So we had athletic trainers. So basically we had a quasi-randomized controlled trial that we executed over 3 years prospectively. So we had an intervention squadron with athletic trainers with sports medicine physician support. And Chris, I know you're an athletic trainer, right? I saw that on your line. So I can relate to that. Anyway, so then we had 2 control squadrons who were identical in every other way, just they didn't have sports medicine support from athletic trainers or a physician. They, we put athletic trainers right in the squadron, right in the building where they train. So we turned a classroom into a clinic and a little mini athletic training room. So it was great. And I would go visit every few days and see the bad injuries and stuff. So anyway, long story short, we did that for 3 years, and our data were very strong. We showed a reduction in attrition, so kids getting sent home for being hurt by 25%, and all-cause attrition went down by 15%. So that was actually the bigger number in terms of dollars. So mental health went up, fitness scores went up, and so basically it made a huge impact. Trainees were, there's higher level of confidence and satisfaction. The commanders loved it because they had, musculoskeletal expertise right there in their building. We were communicating better because we were on site instead of having their trainees go over all the way across the the road to the clinic. And so anyway, it was a big win-win, and it's really revolutionized the way we do care. So because we had such strong data, we were able to get approved for funding to turn this into a sustainable program. And now we have 29, no exaggeration, 29 athletic trainers supporting Air Force basic and technical training in San Antonio. We have a couple of dietitians and strength coaches and 4 sports medicine physicians. And anyway, so it's a big thing. And I got the chance to you know, go down and start something like that in the military. All of the military services do similar things. We put sports medicine physicians into training environments. We put them into operational, like a lot of you know, Army Ranger units and, you know, Air Force Special Ops, Navy SEALs. You know, they all have sports medicine docs. So we take care of tactical athletes. And, you know, a lot of us are involved with some of those really elite, you know, special forces type people. Some of us are, you know, in basic training. They are anything but elite. But they get hurt a lot. So, you know, and, you know, a lot of us go to family medicine residencies too. So we have, the Air Force has a lot of family medicine. All the services have family medicine residency programs. All of them have at least one, usually 2 sports medicine physicians there as part of the faculty. So that's a big part of military sports medicine. I work at the fellowship, so I help train the sports medicine docs. We have sports med docs at the service academies, Naval Academy, West Point, Air Force Academy, all have docs that take care of their teams and their cadets. You deploy. So I spent 6 months in Afghanistan in 2016 and 17. You know, I took care of all kinds of things. We had suicide bombers, we had mass cows, we had, you know, IED blasts, we had, you know, guys going to the gym and tearing their pectoralis. We had, you know, all kinds of, you know, side effects from taking too many supplements. And, you know, that was a fun time. I actually started doing like running workshops. So I would go around base and, you know, word got out and I started doing like after hours, you know, I got nothing else to do. So I would go like teach running workshops for all these units. And, you know, so you got to see a lot, do a lot, and take care of all kinds of different people. But really it comes down to the tactical athlete and what I call, and what many call the world's greatest, or our country's greatest team. And so I find a lot of purpose, a lot of fulfillment in what I do. I think it's fun, great people. I don't have to worry about if my patients have insurance, they all do. I can do anything that I feel like they need. And so I love what I do. I am in GME, so I do a lot of teaching medical students. I see patients with medical students, residents, fellows all the time, every day. It's like the other people. I do, you know, kids all the way up to old people. I do a lot of arthritis care. I do a lot of injections. I do PRP, a lot of stems. I do lipogems and 10X and things like that. The military does support those things. Anyway, that's, I think that's about it. So military is a great way to travel. It's a great way to, you know, meet a lot of really great people and, you know, find a lot of purpose. If you find that wearing a uniform and serving your country is appealing to you, then it's a great place to be. So.
And that's a great story. And you have so much excitement about it. Just, I love that. We did get a couple questions over here on the chat box. So I was just going to start with Gabby. She was saying how several of you have mentioned that matching in residency with Associated Sports Medicine Fellowship. And she's heard kind of the opposite is true, that like if you match into a residency without an Associated Sports Medicine Fellowship, you can kind of prove how much you're like really want it by going out and finding your own experience. Does anybody kind of have any, want to shed any light on that, on what kind of like option they would kind of suggest students kind of look into for residencies?
I'll sort of comment on it. I'm sure Michael probably has something along the same line, something to say as well. I mean, as a fellowship director, as I've started looking at applications, I've had a mix of both. I mean, I see a lot of applicants who come through that are affiliated with, or at a residency that have opportunities. I see a lot that don't. And I will say that there have been a few that have come across my ERA screen that have really blown me away with the lengths that they've gone to find opportunities. One of them was up in Michigan, I think, you know, around here somewhere in the Mitten.
That's
and, you know, yeah, I'm the wrong direction here. So yeah, but you know, so, you know, she's in the Mitten somewhere, and she like had been traveling an hour to go to a college to get some training room experience. And, you know, and that is impressive. And I mean, and I think there's a lot of recognition for that. The one thing that I will say that I think that the programs that have affiliated fellowships have is more ultrasound experience. Mm-hmm. And I feel like that a lot of, and that's not 100% true, but I have noticed kind of a trend that as I'm reading through applications, the applicants who have trained at places where there's a fellowship, where there's a curriculum for ultrasound, where there's that kind of, like, they kind of have that little bit of extra training and kind of a leg up in a way for when they roll into fellowship and start doing more ultrasound in fellowship. And I mean, ultrasound isn't everything, but it is a big piece of what we do in primary care sports medicine and in sports medicine fellowships. And so I think that there is that piece. If you're a self-motivated person and a self-starter and you're going to go after those experiences and have a plan for that, then I think that you could do either and you would be perfectly fine. I think that if you're someone who benefits more by having the opportunities a little bit more there and then opting into them, I think that there's, you know, a lot to be said for that too. I think that there's not a right or a wrong answer. I think it really has a lot to do with your own drive and passion and how that comes across when you put your application forward.
For sure. With that ultrasound experience you were talking about, is that really something that you look into them having before fellowship, or is it something that it's something that you're going to be teaching in fellowship? So maybe like you want to kind of an empty bowl to fill it up. You know what I mean?
I think it depends a lot on the fellowship. My fellowship currently, I would love for them to have some basic knowledge. So I'm not starting absolutely at ground zero, but I know that the fellowship that I trained at, and then also the fellowship that, I mean, that was where I worked for 8 years in Toledo before I went on. I know that when we reviewed applications, because they had a very heavy regenerative medicine program, a very heavy ultrasound, that they really wanted someone with at least some base knowledge coming in, because they're like, we are so busy that to start at absolutely the very, very bottom and work up is going to be hard for you to cope in our environment. And so I think it does depend a lot. And I mean, but yes, I am teaching it. So it's not like you need to come in like fully competent or anything.
Cool. Thank you, Dr. Kiefer. Dr. Swartzon, did you have anything you'd like to say about that question?
Yeah, you know, obviously every fellowship program is going to be different. So my point of view is a little different than Dr. Kiefer. But what I would say is residency is hard. Getting into fellowship is getting to be harder. Don't make it harder on yourself by not being exposed to sports medicine and having to drive an hour. That's what I had to do. So I know that there is a drive and there's people that are there that can make it happen, but why do that to yourself? Usually programs preferentially take their own candidates, plus you have some experience with sports medicine and you have a way to get letters of recommendation, which can be very important in the application process. I look at letters almost exclusively, more than board scores. Just, you know, I find it very important to see what your interest is and if you've worked with someone that does what we do and what they think of you. So getting those letters and getting coverage experience without having at least a sports medicine track in the residency will make it very hard on you. And so if you know going into residency, that's what you want to do, I would rank those programs higher. If you don't get them, that's okay. Like Dr. Kiefer said, you can. I mean, I went to a place that didn't have a fellowship and I'm doing what I want to do. So where there's a will, there's a way, but sometimes it's just easier to take the easier route.
Absolutely, good words of advice. Thank you. And we had one more question here from Jake Herber. It is more specifically towards Dr. Nye. Did you have to wait after your residency before getting into the Sports Medicine Fellowship? He said he's heard Air Force cannot always grant immediate fellowship options.
Yeah, absolutely. Happy to. So Jake, I was just typing in a response, but I'll just delete that. I was lucky enough to get accepted into fellowship right after residency. It's competitive, you know, and every year it varies regarding, you know, how many people are applying. The Air Force has 6 training slots per year, typically. 4 of them will train active duty, and we oftentimes get 1 or 2 civilian deferred slots. So where you will basically collect an Air Force, you know, paycheck, and but you will wear civilian clothes, and you will go to a civilian civilian fellowship and train, and then come back to the military after that. But yes, I was lucky enough to get in my first time around, and what came in straight out of residency. And if you're competitive, your chances are good. So my advice to you is be a strong resident, and focus on being a good resident. Be good, do what you are doing. You know, when you're an intern, be a good intern. When you're on your, you know, inpatient rotation, be a good inpatient intern. When you're on site, be a good psych intern. And do everything that you do and do it well, and focus on that. Get good grades, pass, you know, do well on your boards. All of your scores matter. They get looked at when you apply to fellowship. Getting extracurriculars in, and you know, getting some field side, some, you know, courtside experience. Do some finish line tent stuff if you can, and just get exposed to the field. The other big thing, at least for the military, that I will say really sets you apart and makes your application stronger is some academic activity, some scholarly activity. So if you can get involved with some research, get some publications going, that really sets you apart. And I got into a big, you know, I got a big research study going when I was in residency, and you know, worked really, really hard on that. And I think that, you know, that really made my application stronger, and I would not have gotten accepted, I don't think, if I had not been as strong as I was in research at the time. So I will just say that, you know, do that more in your 2nd and 3rd year of residency. If you do a family med residency, when you're an intern, just be an intern and do that as well as you can. And yeah, I think that answers your question, hopefully. But you know, if you don't get in your first time around, that's okay. Everyone has a different pathway, and there's great ways to go around, you know, so don't be discouraged if that happens to be you down the road. Just apply again, and you know, you will find that, you know, your pathway will be a great one for you, and there's lots of great things to do out there. So don't give up.
Thank you very much, Dr. Nye. We are getting close to that 9:30 mark, and I do want to make sure that we kind of get out of here on time for everybody. Everybody has their own schedules. But we haven't heard too much more from Dr. Daniels or Dr. Wang, so give you guys an opportunity here and kind of just give these guys one last pep talk before you go, kind of why sports medicine, family medicine.
So I will just quick say it's a great combination. I enjoy seeing multiple things, similar to what I said earlier. I think I would get bored if I just saw the same thing over and over again. I do want to piggyback off of Dr. Nye, though. He made a great point about when you're a resident, being the best that you can be, putting your best foot forward. When going over fellowship applications, we do look at what's said in the letters of recommendation, and you don't want to be the applicant who only did sports medicine, didn't show interest in during other rotations. So make sure that you're putting your best foot forward. And also one thing that I would also encourage my students and my residents is to always ask why. Figure out what's the story behind the diagnosis, and also try to push yourself to be better than what you were the day before. So that way you can continue to learn, continue to grow in your knowledge. That's what I have to say.
Thank you so much. And Dr. Wang, one last pep talk.
Some of the best advice I got, as an intern coming in, knowing I want to do sports medicine, and first question from my faculty advisor, like, when can I start covering games? When can I do this? And the best advice I got is, to be a good sports medicine doctor, you have to be a good doctor first. So again, that comes first. So yeah, again, when you have the opportunity, take it to, if you have a free weekend, or you want to, there's a game and you're not on call and you want to go, shadow and cover, by all means take those opportunities to get that exposure. But again, being a good doctor comes first, and you can't be a good sports medicine doctor if you're not a good doctor. And so, yeah, I think I would echo what my colleagues have said. Yeah, I think, for the medical students, yeah, again, I think take the opportunity, I think like Dr. Nye said, I had some experience. I liked a little bit of everything. You see, you're not going to know right away. Use those rotations to see what you like, what you don't like. And that's one of the ways I got into family medicine as well. Is there wasn't one thing I absolutely loved. I kind of liked everything a little bit, and so family medicine seemed like a perfect match. And so, yeah, take the opportunity now to try different things, see what fits for you. Again, as you saw from a lot of our stories, you can go in with one path thinking you're going to do one thing, and you'll find in the end you may end up in a different direction, and really that's going to depend on what experiences you get during med school. So again, if you have the opportunity, get those exposures in sports medicine, but don't block out everything else as a consequence.
Thank you so much, panelists. If you guys wanted to share your email address over in the chat box, if anybody else wanted to ask you a question directly via email, feel free to do that. If you don't feel comfortable with that, it's fine as well. On behalf of AMSSM and MSIG and this continuing series in the Day of the Life of, I want to thank all 5 of you. Great conversation, dialogues tonight. It's great to hear everyone's story kind of had a similar kind of flavor and everything. So it was very great hearing from everybody, and hope you all have a very good night. And thank you so much. We'll cross paths again, hopefully in San Diego.
Thanks for having us.
Yeah,
Thanks,
good night.
Take care.
Absolutely.
Aloha.
I'll see you in San Diego, hopefully.
All right.
Thanks, everyone.
Take care.
Take care.